Good morning, good afternoon, good evening, ladies and gentlemen, from where you are listening to. So, today we have an interesting topic to talk about in this podcast. We are going to talk about diagnostic techniques in hematology. So, what do you mean by diagnostic techniques in hematology? These are the techniques that we use to find a particular disease that one is suffering from. Like, let's say there are other diagnostic techniques in other fields. Let's say for histology, we have screening, we have surgery where they take some tissues, they take some biopsies. And then when you come to parasitology, we have stool samples, we have urine and all that. So the fun fact about it is that the easiest and cheapest diagnostic technique in all departments that I've come across in the laboratory department is hematology. Hematology is non-invasive and hematology is cheap, and its turnaround time, TAT, is shorter compared to other departments. But you can go and look up that from your end, but from what I've experienced, that is how it's fun in hematology. So we have 4 different types of diagnostic techniques in hematology. The first one, we have something called complete blood count and differential. Some people call it full hemogram. This is a process whereby, or a technique whereby, a test tube is used to collect like 3 or 4 ml of blood, and then this blood is mixed thoroughly for it to mix with the anticoagulant that is within the tube, and then there is a machine that automatically runs the blood samples to show all the type of blood categories in your system. Let's say the red blood cells, the white blood cells, and the platelets. So what do we mean by differential? Under red blood cells, there are categories like MCV, MCH, MCHC, all those. So it look at those and give their percentage. When you come to WBCs, that is the white blood cells, the categories also there. They're called lymphocytes, neutrophils, basophils, name them. When you come to platelets, you only look at the PCV. So all these are what we call differentials within the complete blood count. Then number 2, we have something called peripheral blood smear examination. You just take like 2 or 3 microliters of blood, put them in a slide, and then make a film. So it's like you are making a spread of that blood within a slide, and then you stain. So this will show you something called anisocytosis and poikilocytosis, which we mean by the size and the shape of the red blood cells. So the normal shape of the red blood cells is biconcave. So when you see something far from that, you know that there is a defect. So if you are an hematologist, you will know what each shape means, and this can give you a direction to a certain prognosis or a certain determination of the disease. We have something, number 3, is something called bone marrow aspiration or biopsy. This is whereby there is it's called a Treffi needle. It's like a gun-like needle. It's a bit longer. You take samples from the spinal cord. You can also take samples from something called the sternum. It depends, or iliac crest. I wish you could be able to see the signs, but you can Google and see where these biopsies can be taken, or just the aspiration. The aspiration is something like blood from the bone marrow. The blood has some particles because where its origin from, and then you have some tissue when it's part of the biopsy. Just take a small tissue and then it undergoes now histology, where you do something like processing, sectioning, staining, and then the pathologist reads what the slide depicts. The last one, we have coagulation profile. This test the rate at which your blood clots. There is 2 pathways of clotting of blood in our system. What helps? The enzymes, everything that helps in blood clot. You look at that scheme, and then INR, the time it takes, it's in seconds, the percentage, all that is analyzed when you're doing the coagulation profile. The fun fact about this test, all of them except number 1, complete blood count, the rest, that is PBF, bone marrow aspiration and biopsy, coagulation profile. The fun fact is all these tests must be accompanied by a complete blood count. That is how important complete CBC or full hemogram is important in hematology. Thank you. If you have any discussion, any more question, you can hit me up and I'll give you a response. Thank you so much. Bye-bye.